Hello, good evening. My name is Julianne Pictou. I have the lovely Serena with me. She's going to help me with my final assessment. So I know I already said your first name, but can you state your first and last name for us?
Serena Wright.
And your date of birth?
8/11/94.
And what season are we in?
Winter.
And who is the president?
Donald Trump.
Perfect. Do you have a specific diet that you have to go by or that you prefer?
Mostly vegetarian.
Okay. And what is your greatest level of education that you've reached?
I have my bachelor's in nursing
And where is your current job?
at Florida Hospital.
Perfect. And how many times a week do you work out, if you work out?
3 to 4 times a week.
Beautiful. We can tell that her speech is clear. She has a good affect about herself. And have you taken a shower today? Don't lie.
Yes, I have.
Good. And she's clearly kept her hygiene up. So I'm just going to feel her skin for her temperature. She's nice and warm. She has that pink and she has color towards her as well. Skin turgor, you can see it's retractable. She's not dehydrated at all. And she has a good texture. Her hair is up in a bun, but it's still combed and it's pretty clean. There's no oil from her appearances. And just feeling her scalp, she doesn't have any lesions, no lice involved, no parts are falling off, and she's fully intact. As far as her hands and nails, I know that you didn't see it, but they are clean, they are manicured, as a nurse's nails always should be. And there's no flaking of anything. She also, I'm going to just assess her cranial nerves. Can you smile for me? Stick out your tongue and say you can't teach a dog new trick.
Can't teach a dog new tricks.
Perfect. So we can see that she's fully intact with her facial as well. I'm just going to check for her senses really quickly. All right, I'm going to do 2 different types on your face. Can you, what kind of is this?
It's soft.
Very soft. And then, what is this?
Sharp.
Sharp. So she is able to figure out the 2 different between soft and sharp on her face as well. And for her sinuses, if we ever have that sinus infection, it would just be right up here, the mandible, right underneath here. And sometimes it can go in here as well. I'm going to check her TMJ very quickly. Can you open your mouth for me? And close. Perfect. So there's no cracking. There's no in between there. So her TMJ is intact as well. And we already talked about her sinuses and her frontal sinuses. For her eyes, I'm going to do a Snellen chart on her very quickly. All right, I'm going to hold this by here. And can you tell me the first number right there?
9.
And then the third line, can you tell me the first number?
Ooh, I don't have my contacts. I can't see that far.
It was a 2 for everyone watching. She clearly has glasses, and I got her off moment with the contacts, which she was able to see. I'm just going to do a quick assessment on her eyes as far as just checking for her perla and doing her other ocular nerves. All right, so this is going to be really bright. I'm sorry, I'm not going to try to blind you. All right, so look straight ahead, that wall for me. Perfect. Perfect. All right, I'm going to shine this off, and can you follow this? But don't move your head. Perfect. All right, so she does have perla. Her pupils are equal, round, and reactive to light, and she does have that accommodation as well. She didn't have her sclera is white, no conjunctivitis, nothing is running down her eyes, and she had her extraocular motive, so she had the 2-3 intact as well. Normal pupil size, about 2 to 3 milliliters, and we use this as well. Because her contacts are not in, I'm not going to do the red on her, and I can't get this red part to work on here, but we did do that Snellen chart. So I'm just going to check her ears as well. I'm just going to use the same device, and we're just going to see if it's nice and shiny and white in her ears. All right, just going to take a peek right here. All right, perfect. You see her eardrum. That opaque, clear, beautiful. No signs of ear infection, and she's able to hear me as well. But we're going to do this lovely test. I'm just going to put this on top of her head. And tell me if you can hear this.
Mm-hmm.
All right, I'm just going to do on the back. Checking the mastoid. Then we're going to bring it out here. You still hear it?
Mm-hmm.
All right, we're going to the other side. Mastoid, and then here it is out here. Perfect. So normally you hear from the other side a little bit longer than you would on your mastoid, but we've also checked her hearing as well. And we checked for the hearing test for the tuning fork. Now we're going to take a look at her nose. We're just going to take the external part and we're just going to look at the patency. Not that we're giving her an NG tube, but just to check me if we do a nasal swab, but we're just going to check to see. So you can just tilt your head back for me. Both of her nasals, we could put anything in there, and I'm just going to take a little peek at it. So it's going to be another bright light. This one's a little bit brighter. I'm just going to take a peek. Beautiful. Nothing running. No congestion. Flu season. Did not get her this time, so her nose looks great. And nasal patencies in her spectrum, her no nasal mucus or septum was all intact. So we're going to move a little bit further. I'm just going to take, I'm just going to listen to her lymph really quick. And you're not sick at all. Nothing's there. Open that tongue. I know it's nice and pink, so she has a good mucus. She's not at all inflamed around here. And then this is where her jugular veins would be as well. So while she's here, and I have my stethoscope, I'm just going to go ahead and listen to her heart and lungs. All right, take a deep breath for me. Good. You can exhale. Beautiful. Beautiful. I'm just going to go on the side right here. And then the other side as well. While I'm on this side of her, I'm going to listen to her heart, so I'm going to listen to her apical. Alright. Beautiful. I'm going to do it down here as well. And don't mind my dog in this video. The last one, perfect. Apes to men all over her the S1 and S2 as well. I'm just going to listen to her back and also deep breath for me. Another one. And last two. Beautiful. All right, I'm just going to check for, say 99,
99.
99,
99. 99.
Perfect. So we checked her lung sounds and everything is clear. We also did apes to men with her. Everything was clear as well as far as her heart sounds. So she had no tactile fremitus or no lupus. There was no tenderness. Was there any tenderness in your lungs? I'm speaking for you. And so her breath sounds, there was no, they're all adventitious and clear. So now I'm just going to go down and check her abdomen. We're just going to check to see the symmetry between them, and we're just going to make sure that everything is same. So we can see there's no lumps at all. I'm sorry, my hands are very cold. No lumps at all. Everything. I'm just going to take a listen really quick in all four quadrants. I'm going to start up here. Oh, I hear you had supper recently, didn't you? Mm-hmm. Beautiful. And then I'm just going to percuss your liver over here. Beautiful. Spleen over there. Any tenderness at all. No bloating, no ascites, nothing in her abdomen. We could, I know that you can't feel it, but she does have some pulsations. Just along here, you can feel the pulsation as well. And you can hear that she has active bowel sounds in all four quadrants. So we percuss her liver, her spleen, her kidneys will be right on the side, right back here to percuss, right underneath in that flank area on both sides. So she has all those intact, and there's no tenderness. I just did the very light palpitation. I didn't want to go too deep on her, but everything is fine with her abdomen. So for her lower extremities, we're just going to take a look at her legs. They're both symmetrical. Not one is longer than the other. I don't know if you can see. I'll tilt it down just a little bit for you. And so we're going to check. I'm just going to check a couple of pulses. We're going to go right underneath here behind the kneecap. That wasn't as intact. Up here as well. Her femoral will be right here in this groin area. That's intact on this side as well. And then we're going to check her popliteal, or her pedal, rather, is up here. And the popliteal was the first one that we did in the back. So all of her in contact as well. She is able to move her legs as you see, but I'm going to check for her reflexes. So I just want you to relax your knee for me. And then we're just going to go right along here. Perfect. I'm just going to do the other one along here. Beautiful. So she has, her reflexes are intact as well. And we did her pulses. Her skin is intact as well. Her temperature is nice and warm. There's no edema. I'm going to press for you and see. There, you can't see my fingerprints. There's nothing going on there. And we'll do the other one as well. Just going to press, press, press. No edema, which is good. And she has good strength. So I'm just going to have you pull up on my hands. Don't let me push you down. And then try to pull down. Beautiful. So she's nice and strong on both those legs. And her knees are intact as well. I mean, she's able to move. We already checked those reflexes and her ankles and feet. Can you wiggle your toes for me? Beautiful. So she's able to move around. I'm just going to assess her walk very quickly. So I'm going to take this stool away from you. I'm going to just have you walk to this door. You can turn around and walk straight to this door. Beautiful. You can turn around and walk right back. Take a seat right here. So we can see that she has a steady gait, nothing. She's not falling. She doesn't have a weakness, and there's no deficit as well. So she was able to walk across the room. I'm so sorry. I'm going to have you walk on your toes and on your heels one more time. So we're going to do the same exact thing. Walk on your toes, and then come back and walk on your heels. Beautiful. Beautiful. So she was able to walk on her toes and her heels, still having a good gait. All right, and then I'm just going to, I know this is a little bit hard to be flexible, but can you touch your toes for me? If you go straight out, close. And then try the other one as well. Close, as everyone would be with this flexible, but she is able to check. I'm just going to have her bend forward a little bit. I'm going to check her spine just to see. It's intact. There's no curvature and no issues there. So her spine is intact and is good. We already checked her lips, we already checked her mucus, her teeth and her gums. Sorry, I'll put this forward for you. So everything was intact. We already stuck out her tongue to check 9 and 10 cranials. She did have that hard and soft palate that we saw when we assessed earlier. For her uvula, that's when she stuck out her tongue, and she was able to do that as well. We already checked her neck for symmetry. We already did the pulsations. I'm just going to show you where the carotid would be. I know that people would check a lot about that. So you're just going to go right underneath the jawline, very light. You can see it. This is where a lot of people check for the pulse for CPR, just to see if they have a carotid. We already showed you where the jugular was as well. Her trachea is nice and intact. There's nothing, it's nice and straight, nothing is bulging, and so that's intact. We also are going to palpate the thyroid, so that's right above this little area, right above here. And nothing seems to be inflamed, so she is good in that area. For her thoracic cage, just going back down to her chest, all of her lung cells were clear. I'm not going to tell her to take off her sweater, but everything was symmetrical. There was no tactile fragmentus, and her spinous process was intact as well. We percussed over the lung fields, and she had those clear lung sounds. Her respirations and skin characteristics, everything was clear and intact. And we already percussed her fields. I'm just going to do a little neuro assessment on her just to get the rest of her musculoskeletal as long as her neuro. So I'm going to have you squeeze my hands for me. Beautiful. You can let go. I'm just going to check her pulses again. All right. Stick your arm straight out. Touch your nose. Touch your other nose. And then touch my finger with your finger. And then the other side as well. Beautiful. Okay. So she is able to have that range of motion for as far as that neuro test. I'm going to check an Allen's test. This is where you are just going to include the radial part of your wrist. So I'm going to include this part, and then hopefully it will get white. And then when you release, it will turn back to red. Let's do the other side. You can include that radial. I don't know if you can see that hair is turning white, and then you go back, and it instantly turns back to red. So that's good. So we know that we have circulation in both of those. Both of the parts of the hand, which is important. I'm not going to tell her to take off her sweater to assess her breasts or her nipples, but we did discuss about breast exams and how you should do it once a month, especially around that period time. Just to assess, you want to be in the shower, you can raise your hand, assess in a circular motion, go down, as well as for the other part, just to assess for any masses. And as far as getting yearly annual checks, pap smears, especially for a female. That's very important to do. We already checked the sensation of the face, arms, hands, feet, legs. We accept her cerebral function. We did that nose to test. We did a couple of the reflexes as well, and she's not in any specific pain or any ailments, unless you didn't tell me this earlier. Perfect. So other than that, we did a full head to toe assessment, and I appreciate you for watching. Thanks so much.